Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, we're talking about children's eyes. I speak with Dr. Megan Collins, a pediatric ophthalmologist at Johns Hopkins, about the impact of all that screen time and time away from school on how children see the world. Let's listen. Dr. Megan Collins, thank you so much for joining me for this podcast. Children have been affected in many ways during the pandemic. You're a pediatric ophthalmologist. How do you see the impact of the pandemic on children?
Well, thank you. It's great to be here today. And one of the things that we've noticed over the past year and a half is that with the pandemic, there's been a massive disruption of how students are normally educated, meaning they usually go to the classroom every day. In a school building. And what's happened is so much of their time has been switched to virtual. So we've seen lots of things coming up because of the amount of time kids have been spending on screens.
So there are a lot of questions about how well kids learn on screens, but what happens to their eyes?
So there's some evidence coming out, particularly from Southeast Asia right now, where there had already been an epidemic of myopia, which is nearsightedness. That due to the pandemic and due to the amount of time that kids are spending on screens or just in lockdown and not going outside, that we're seeing more nearsightedness.
How does that happen?
The theory is that because they're spending so much time on the computer that they're accommodating their eyes and looking up close a lot. And as they continue to do that, that actually causes an elongation of the eyeball itself, which increases nearsightedness. Now, a little bit of nearsightedness, not a big deal, but if you become very nearsighted, you're actually at risk for lots of other vision problems, including things like retinal detachments or bleeding in the back of the eye.
Have you seen that in your practice?
Fortunately not, but I've seen a lot of kids become nearsighted in the past year that had not previously been nearsighted. So a lot more kids needing glasses now than we had seen previously.
Right, because I'm nearsighted. And so I understand that I can actually see the screen pretty well without my glasses. But then when I try to look outside, it's just one big blur. So the risk here is that kids are, maximizing their eyes for the screen in a way, but then they go outside or they are in a classroom even, and they can't see the board.
Exactly. And, over the past decade or so, one of the things that we've learned about how do you slow down nearsightedness is actually spending time outside in physical activity. And we don't know whether it's the sun exposure or the physical activity itself, but sometimes that seems to slow the progression of nearsightedness. But kids have been inside, they've been on screens all the time. So they've had a lot of factors contributing to them becoming more nearsighted.
And parents might not notice that. Is that fair to say?
That's the challenge with most vision problems with kids. They're usually asymptomatic. So a child is not necessarily going to notice, even though when you look outside, you see a blur. If you were, say, an 8-year-old, when you notice that, you might just think that's normal. And that's where, the fact that they're not in school becomes a bit of a challenge because it's typically in schools that kids get their vision screened. And that's often where they get detected as having a problem.
Right. That's one of the reasons that there is school vision screening, is that it can be hard for kids to complain if they don't know
exactly
any different than seeing, I remember, I think I might have said to my mom, I didn't realize all the trees had leaves on them, when I got glasses. And so I just didn't realize it, but at some point I screened for glasses. I think it was like second or third grade. And if they weren't in school, then maybe they got missed altogether.
Exactly. And we have been doing some work on this, looking at what's been happening with vision screenings across the United States. So before the pandemic, 41 states, that's including the District of Columbia, so 41 out of 51 in the US, mandated vision screenings for school-age children. But what happened is, as of March 2020, 50 million kids were out of school. And that carried over into the 2020-21 academic year. And lots of schools were not open or they weren't open full time. So many of the school-based screenings that happened, including vision, were either suspended for the year or kids just didn't get them because they may not have been in the school building the day they happened.
So we have potentially a worse vision problem for kids, more kids with nearsightedness, and less access to detection and treatment for this problem.
Exactly. That's what keeps me up at night, worried about. I think we've recognized kids have lost out so much during the pandemic with the disruption of their daily lives and being in the school building. And I think there's been a lot of attention on the other things that have been impacted by schools. But I think there needs to be more of a discussion of how it's impacted something like their vision and how do we recover from this?
Now, vision is pretty important for kids, right? It's not just about seeing the details on the trees. You've done some research on this.
I have. We just published an article in JAMA Ophthalmology about a week ago, actually, about a program that we run in partnership with a Baltimore City Health Department, the city school system, Vision to Learn in Warby Parker, called Vision for Baltimore, where we bring everything related to pediatric eye care into the school setting. That's the vision screenings, the eye exams, and the glasses. And we looked at the academic impact of that. So how does that impact children in their learning? And we saw this huge positive impact for kids on their learning when they got glasses.
Can you give me a sense of the scale of the impact of glasses for kids who need them?
So for kids who need them, my education colleagues helped us do some of these calculations. For all kids who benefited from glasses, it was roughly equivalent to 2 to 4 months of extra time in school, extra additional learning time. And for kids who benefited the most, which was usually kids who were in special education or who were performing in the lowest quartile of their class at baseline, was actually 4 to 6 months additive learning time was the equivalent. So showing that kids who need glasses really can benefit and it can help give them the boost in learning that they need.
So we have a situation where more kids are likely suffering from vision problems. Fewer kids are getting diagnosed with vision problems, and it really matters for their learning. And this is part of the gap that kids have fallen into during the pandemic. How do we dig ourselves out of this?
I think having discussions like this is part of the steps forward. We need to bring more awareness to it in terms of making sure that all states are doubling down on the screenings that they should be doing or that they may have missed during the pandemic. This needs to be discussions with parents, with teachers, with pediatricians, so everybody is aware that kids should be screened for vision problems. If they're having any, they should connect with eye care providers. It's a perfect way to think about how to build out more school-based vision programs, because these programs bring everything into the school, particularly in disadvantaged communities where kids may have already been having issues accessing care in the community. So we'll bring it all into the school setting. And we have a lot of kids now, many more kids back in the school buildings this year than we had previously.
Thank you, Dr. Collins, for setting out this challenge and really pointing the way for what needs to happen. Everybody who is in contact with kids should be thinking about their vision.
Exactly. Thank you for inviting me to talk about this with you today.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holes Fernandez and Caroline Wong. Thank you for listening.